serious health problem throughout the world and its prevalence is rapidly increasing. So, diabetes mellitus is a chronic multi-system disease. Means chronic means once a person get diabetes, then there is no cure for diabetes. Just that a person has to maintain. There are many measures to control the blood glucose. But once a person get diabetes, means there is no cure for diabetes. And why it is said multi-system disease here means it does not affect only one system, but this diabetes can affect multiple system. For example, your urinary system, gastrointestinal system, and many other system diabetes can affect. And what happened in diabetes mellitus is there is abnormal insulin production. So when the pancreas does not produce enough insulin or less insulin, then the body will not be able to uptake the glucose into the body cells. So what happened then? The blood glucose level will be high and impaired insulin utilization. Insulin utilization means if the body cells cannot utilize the insulin properly to uptake the glucose, that is termed as impaired insulin utilization. Or it can be both abnormal insulin production and impaired insulin utilization. Are you clear? Any doubts?
Yes, ma'am.
Okay.
Ma'am,
Okay.
ma'am, if a person is sick with diabetes, it cannot be uh, taken care with foods, with the exchange of foods and diets, ma'am. If we take in the early age.
It depends on the glucose level, okay? So this one related to this will come later in the next slide, okay? I will explain in the next slide.
Okay.
So I'll move on to the next slide, okay? So types of diabetes mellitus. No. We'll discuss first about type 1 diabetes mellitus. So type 1 diabetes mellitus account for only 5 to 10% of diabetes, and type 1 diabetes, formerly it was called as juvenile diabetes mellitus, insulin dependent diabetes mellitus, and is caused by destruction of the beta cells of the pancreas. So the diabetes as compared to type 2, type 1 diabetes mellitus, it occurs less, and formally it is called juvenile diabetes mellitus. Juvenile means early age, okay? The onset is early. That's why only they term it the juvenile diabetes mellitus. And insulin dependent diabetes mellitus means in type 1 diabetes mellitus, the patient will require insulin. So it is termed as insulin dependent diabetes mellitus. And the type 1 diabetes mellitus is caused when there is a destruction in the beta cells of the pancreas. Causes. The exact cause of type 1 diabetes is unknown, but if you have any family history, then there is a risk of developing diabetes, and viruses that injure the pancreas, alcohol consumption, removal of the pancreas by surgery, and autoimmune processes. All these factors can lead to type 1 diabetes mellitus. Clinical manifestation of type 1 diabetes is first there will be history of recent and sudden weight loss. And the classic symptoms, keep in mind, okay, all these red wording, polydipsia. Polydipsia means excessive thirst. Polyuria means frequent urination, and polyphagia means excessive hunger. So a patient with diabetes mellitus will show signs and symptoms of these three: polydipsia, polyuria, and polyphagia. And now let's talk about type 2 diabetes mellitus. So type 2 diabetes mellitus, this is formerly known as adult onset diabetes or non-insulin dependent diabetes mellitus. What happened here is the pancreas will produce insulin, but it is not enough for the body, or it is produced in less amount. So in this type, the patient will not require insulin, and the onset is mostly in adult, and it is most prevalent type of diabetes, accounting for approximately 90 to 95% of the patient with diabetes. The risk factors for type 2 diabetes mellitus are being overweight or obese, and being older, having a family history of type 2 diabetes. I hope everybody knows about this overweight or obese, like how you calculate this. What is BMI?
Yes, body mass index.
Body mass index. So how do you calculate this body mass index?
Height square by width.
Height square by weight. Height in centimeter or meter?
Meter.
Meter.
Are you sure it's in meter?
Yes, ma'am.
Okay. So when you tell anything related to all this calculation, you have to mention the this unit also. Okay. So what is a normal BMI? The normal
Yes, ma'am.
range. The normal range. Any
See,
idea? Whatever you know, you tell. In case if you are wrong, I'll correct it.
19 to 24.
Okay, so like 18.5, 19, it's okay, 24, 25. So this range is that we consider as normal BMI. So if it goes above 25, then we will classify them according to overweight. So the clinical manifestation for type 2 diabetes mellitus are actually the usual presentation is low and typically insidious. Insidious meaning is the patient will present the sign and symptoms gradually, slowly, but it is harmful. That is the meaning of insidious. Okay, and patient may present with fatigue, poor wound healing, and recurrent infection, along with those polyuria, polydipsia, polyphagia. And pathophysiology. Pathophysiology meaning is how the disease developed. So in type 2 diabetes, the pancreas usually continue to produce some endogenous. Endogenous meaning is self-made, okay? So endogenous insulin. However, the insulin that is produced is either insufficient for the needs of the body or is poorly used by the tissues or both. So in type 2 diabetes, the body will produce insulin, but that insulin is not enough for the body, or maybe the body cells or the tissues cannot utilize this insulin. That is the insulin resistance. And the presence of endogenous insulin is a major distinction between type 1 and type 2 diabetes. Means to diabetes, there will be endogenous insulin, whereas in type 1 diabetes mellitus, there is no endogenous insulin. And we'll talk about another classification, that is the gestational diabetes. Gestational diabetes occurs in about 2% to 10% of the pregnancies. Means gestational diabetes is like when a mother gets pregnant when a mother gets pregnant, that time maybe the mother is previously she don't have diabetes, but after getting pregnant, if she get diabetes, that is termed as gestational diabetes. So women with an average risk for gestational diabetes are screened using an OGTT. OGTT full form is oral glucose tolerance test. Oral glucose tolerance test. So this test will be done at 24 to 48 weeks of gestation. Gestation means those pregnancy period, okay, the meaning. And most women with gestational diabetes have normal glucose levels within 6 weeks postpartum. So, suppose if a woman develop this gestational diabetes during pregnancy, but after the delivery of the baby, after 6 weeks, in most of the cases, the blood glucose level will return to the normal level. But unfortunately, those women who have gestational diabetes have a 35 to 60% chance of developing type 2 diabetes within 10 years. And, other specific types of diabetes. Cushing syndrome. So, for now, I will only briefly explain the term, but in later you will get class for all this topic also. Cushing syndrome. Cushing syndrome, this is a condition in which your adrenal cortex produce the stress hormone cortisol. So when the cortisol level is in excess, then that is termed as Cushing syndrome. And hyperthyroidism. Hyper means high. So when the thyroid gland produce more thyroid hormone, that is termed as hyperthyroidism. And recurrent pancreatitis. Pancreas meaning your pancreas. Itis or itis means inflammation. So this means inflammation of the pancreas. And cystic fibrosis. This is an inherited condition in which your mucus producing cells, it will affect the mucus producing cells of the body. And what happens is mostly it will affect your lungs. So when they affect the mucus producing cells like goblet cells, what happens is it causes thickening of the mucus. So it will block the respiratory tract. Hemochromatosis. Hemochromatosis means excess iron in the body. And parenteral nutrition. When you give nutrition intravenously, that is termed as parenteral nutrition. Like some of you, you must have seen that TPN, total parenteral nutrition, which comes in the form of bag. And medications like corticosteroids, anisolone, and then thiazides, corticosteroids, drug, and mainly anti-inflammatory property. And phenytoin, we give in patients who have seizure. And typical antipsychotics. Antipsychotics are for we give to psychiatric patients. So all this condition and cause insulin resistance. So because of that, it can result in high glucose level in the blood. Okay, so let's see the difference between type 1 and type 2 diabetes mellitus. As of onset, as I have already told, type 1 diabetes mellitus, it is more common in young people, but it can also occur at any age. Since it occurs in young people only, it is, before I told that it is also called juvenile diabetes mellitus. Whereas type 2 diabetes mellitus, it usually occurs after 35 years of age or older. And type of onset. In type 1 diabetes mellitus, signs and symptoms usually abrupt. Whereas in type 2 diabetes mellitus, the patient will manifest the signs and symptoms slowly, and it can go undiagnosed for many years. The prevalence. Type 1 diabetes mellitus account for 5% to 10% of all types of diabetes, whereas type 2 diabetes mellitus account for 90%